Most people think a stroke is one thing, one event, one cause. But that's not how it works. A stroke is more like a category, and inside that category, several completely different things can go wrong inside your brain, each for a different reason, each with its own chain of destruction. Some strokes happen because blood can't get in. Others happen because blood escapes somewhere it was never supposed to be. And understanding the difference isn't just medical trivia. It changes everything about how doctors treat it and whether you survive. Today, we're going through every major type of stroke and what actually happens inside the brain when each one occurs. Think of your brain as the most expensive city on Earth. It never closes. Every second, it's running millions of operations. Your heartbeat, your memories, your ability to read these words right now. And like any city, it needs a constant supply of resources. In this case, oxygen and glucose, delivered non-stop through a network of blood vessels. Now imagine the power grid to that city gets cut off. Not for hours, for minutes. That's all it takes. Brain cells are extraordinarily sensitive. Without blood flow, neurons begin dying within 4 to 6 minutes. Unlike other cells in the body, brain cells don't come back. When they're gone, they're gone. That's what a stroke is. The moment that supply line fails and the clock starts ticking. The most common type is called an ischemic stroke, and it accounts for roughly 87% of all strokes. The word ischemic simply means a lack of blood flow. Something is blocking the pipeline. The brain downstream from that blockage stops receiving oxygen, and tissue begins to die. But here's where it gets more specific, because not all blockages are created equal. The first kind is a thrombotic stroke. In this case, the clot forms right there, inside a brain artery. Think of it like a traffic jam that builds up in one spot over years. The road narrows, cars pile up, and eventually nothing moves. That narrowing happens because of plaque, a buildup of fat, cholesterol, and other substances along the artery wall. High blood pressure, smoking, diabetes, and high cholesterol all accelerate this process. The wall gets rougher, the channel gets tighter, and one day a clot forms directly on that damaged surface. Traffic stops completely. The second kind of ischemic stroke is an embolic stroke, and this one travels. The clot doesn't form in the brain. It forms somewhere else, usually the heart, breaks loose, and floats through the bloodstream like debris carried down a river. It drifts along just fine until it reaches an artery too narrow to pass through, and there it lodges, cutting off flow instantly. One of the most common causes is a heart condition called atrial fibrillation, where the heart beats irregularly and blood pools inside it, forming clots that can escape into circulation at any moment. Before we move forward, there's one more ischemic event that deserves its own moment: the transient ischemic attack, or TIA. People call it a mini-stroke, and the name is both accurate and misleading. The blockage is temporary. Blood flow returns. Symptoms disappear, sometimes within minutes. A person might feel confused, lose vision briefly, or struggle to speak, and then feel completely fine an hour later. That recovery is real, but the danger is not gone. A TIA is often a warning shot before a larger stroke. Studies show that roughly 1 in 10 people who experience a TIA will have a full stroke within 3 months, and nearly half of those occur within the first 2 days. Feeling better does not mean the crisis has passed. It means the clock has started. Now we shift into completely different territory, because so far, every stroke we've discussed has been about blood failing to reach the brain. But there's a second category, hemorrhagic stroke, where the problem isn't a missing supply, it's a rupture. Blood that was supposed to stay inside a vessel escapes, flooding areas where it should never be. Picture a balloon inside a sealed box. If that balloon expands too much and bursts, the fluid doesn't disappear. It fills the box, pressing against everything inside. That's what happens inside your skull when a blood vessel ruptures. The brain has no room to accommodate extra fluid. Pressure builds, tissue gets compressed, and the damage compounds with every passing second. There are two main types of hemorrhagic stroke. The first is intracerebral hemorrhage, bleeding that occurs directly inside the brain tissue itself. A vessel bursts and blood spills into the surrounding neurons, destroying them on contact while simultaneously creating pressure that damages even more. The most common cause is chronically high blood pressure, which over years weakens the walls of small vessels until they simply give out. The second type is subarachnoid hemorrhage, and this one often announces itself in a way people never forget. Bleeding occurs not inside the brain tissue, but in the space surrounding the brain. The most frequent cause is a ruptured aneurysm, a weak, ballooned section of an artery that tears open. People who survive describe it with striking consistency. The worst headache of my life, sudden, explosive, like nothing before it. That description alone, in a medical setting, is treated as an emergency until proven otherwise. Now you know what's happening inside the brain. But in the moment, how do you recognize it from the outside? The acronym FAST was built for exactly this. Face drooping, one side of the face falling or going numb. Arm weakness, one arm drifting down when both are raised. Speech difficulty, words that come out slurred, confused, or not at all. And time, because with every minute a large vessel stroke goes untreated, nearly 2 million neurons are lost. Call emergency services immediately, not after waiting to see if it gets better, not after a quick search online. Immediately. A stroke is not one thing. It is a family of events, each with its own origin, its own mechanism, its own window for intervention. But what every type shares is this. The brain is losing something it cannot survive without, and time is the only currency that matters. Knowing the difference between these strokes could change how you respond when it happens to someone standing right in front of you. And that knowledge, that 30 seconds of recognition, might be the thing that saves their life.